Subcutaneous closure is important to eliminate any dead space which can cause post-operative fluid collections as well as offload tension from the eventual skin closure. Subcutaneous tissues are usually approximated with polyglactin 910 sutures coated with triclosan, also called Vicryl Plus. Here, I'm using a 3/0 suture on a round body needle. The interrupted sutures are taken in a buried fashion, where the first bite is taken on the side towards me or on my left side, such that the needle moves from deep to superficial tissues. The second bite is taken on the opposite side with the needle moving into the depth of the incision. The two ends are tied with a standard surgeon's knot. Buried sutures allow the knot to lie deep within the tissues. Subcutaneous closure can be performed in one or more layers based on the thickness of the pannus. The use of drains is left to the surgeon's discretion.